Okay, good morning. So, we will be talking about water related diseases. This is one of the most prominent determinants or hazards in environmental health. Before we start, can we try to do this? Which of the following is not a usual criteria to identify an important public health problem? This kind of indicators, what we call them as indicators, they are often used to identify diseases or conditions of public health importance. Which of these do you think is the correct one? Yeah. Okay, so somebody said A, one more try. Okay, D is the correct answer. So, year lived with disability, YLD. If you remember, there was a term called as DALI. Year lived with disability is part of that, and years of life lost is another part of DALI. Years of life lost is both any expected death and unexpected death, especially the unexpected death. But even expected deaths also predict which of the diseases or health conditions should be of public health importance. And why we are talking about this? Because this often will come into picture when we talk of epidemiology of any condition or any hazard. Okay, so we have used the Park's textbook for this and the WHO's Water, Sanitation and Hygiene Burden of Disease global database. We will be talking about some important terms and conditions. You are expected to know some of these. If you don't, I will explain some of these very briefly. Then we will go through all these from learning objective to this important source of water, sources of water, the mode of contamination of water, what are the diseases that are related to water, the role of water in human disease, and how do we prevent and control some of these at a larger level, not at a individual level. So, I hope you know epidemiology. Can you tell it what is epidemiology? Epidemiology, phone band kar lo. Distribution, right? So, epidemiology means distribution of something. Anything else? Epidemiology? It has basically 4 components. So, one is distribution of things, description of things, description of risk factors and diseases, determinants of diseases, distribution ke baad determinants of diseases, and if at all anything is done, any intervention is done, how effective that intervention is. That is all about epidemiology. So, when we talk of epidemiology of certain condition, we are talking of at least these 4 things. Okay, so somebody from there, anybody who is asleep right now? Bag, hiding behind bag. Yeah, you are looking behind the specs one. Bag. Yeah, bag ठीक कर लो पहले, and then please tell us how control is different from elimination and eradication. Quickly. पढ़ लो बैठो यार, यही सब आएगा एग्जाम में. यस, अनदर बैग. या नो नॉट यू, हर हाइडिंग बिहाइंड द बैग. तुम ही? हाँ जी, आप ही. बैग सीधा कर लो और बताओ. बैग सीधा कर लो. यस, एंड प्लीज आंसर इट. कंट्रोल वर्सेस एलिमिनेशन वर्सेस इराडिकेशन. आई गेस यू हैव बीन टॉट दिस, right? Must be taught beforehand. No idea? Right job. Sit. Control is when we try to prevent disease at a initial level. Suppose the burden is 100 excess deaths. So, we are trying to do interventions, we are trying to do using strategies which can prevent, say for example, 70 of those deaths or 60 of those deaths. So, that the public, the people, the government is not that much bothered about it. There is not a lot of news in media. The people life becomes a bit easier, then it's controlled. Elimination, when the disease stops being a public health problem. Say for example, out of 100, 95, 98 has been removed, and eradication 0. And not only 0, the agent which causes the disease is gone forever. We cannot find the agent of which virus? Which virus? Smallpox virus. So, you cannot find it in nature now. You can find it only in 1 or 2 labs which are known, or 1 or 2 hidden labs. Otherwise, we cannot find. Nobody can claim that he or she can find smallpox virus in either human body or outside human body. If you do so, you will get a nice prize from WHO. Right? So, that is eradication. Not only the disease is gone, the agent is also gone. What about spectrum of health? Any idea? I will show this. First chapter method, spectrum of health, levels of prevention, primary health care, because when we talk of water, these words will come along. Then there was a concept of health for all versus Millennium Development Goal versus what we now have, Sustainable Development Goals. So, whenever we talk about epidemiology and then prevention and control, we talk of these things. Then pertaining to water, I hope everybody knows what is water cycle. Wash, any idea? Wash. We wash. That's why we have wash. No? Safe water. How do we? अभी सबसे last में कौन आया? Who came at last? Yeah. Safe water. When we say this water is safe. How do we say that the water is safe to drink? Okay. Anything else? How do we know purification हो गया? There would be claim that it is pure. If you go and someone's home and the person offers you water, PGA, and you ask, pure है ना? Yeah, pure. So how do we know that this is pure? हाँ जी? TDS. Okay. That's chalo. So you know a bit physical component of water. I'll show you. And then there is a very specific term called as problem village. Any idea? Okay, I'll show you. So spectrum of health outcomes starts from what we are very fond of as doctors, deaths, and it goes to the positive direction of health up to positive health. So it starts from positive health. The best thing, positive health is more than what we are capable of doing or what we are doing right now. So positive to better health to freedom from sickness. So this is from where the medical people start to get interested. So freedom from sickness, unrecognized sickness, mild sickness, severe sickness, and ultimately death. So we as doctors are more interested usually with this. This is where people come to hospitals. This is where a bit of community medicine works, and this is where we aspire to be someday. Not right now, we are not as a country. So there are countries in the world who are talking in terms of this positive health. The counterpart of proxy of that is called as well-being. So I hope some of you might have come across terms like quality of life, activities of daily living. So when a patient comes to you and seeks, Dr. Sahab, मैं ठीक हूँ कि नहीं, it's not about whether he will die today or tomorrow, or he has some severe sickness, or you get them tested for something. They sometimes want to know about this, may not be able to express, but they often sometimes need to, they want to talk, they don't have word, they don't have the context or idea how to say that, right? So whenever we do interventions or do epidemiology in public health, we often should be talking about positive health and welfare health. So in water, positive health will come into picture. Levels of prevention, I hope everybody is aware of, from primordial to primary to secondary to tertiary. It applies to water also. So say for example, screening, early diagnosis and treatment comes in secondary. When we talk of water related diseases, whether in epidemiology or control program, are we talking of those things or not? Then primary health care. So we have core principles and elements of primary health care. Very popular question. You will always be asked about this, not only in theory, also in Viva. So what are the 8 elements of primary health care? If the external expert who is preparing your question paper doesn't have time and he has to submit the question paper today by 5 p.m., he will obviously ask this question. Most popular question among the community medicine teachers, and the components or pillars. So, it has a new pillar, decentralization. These are the pillars which were talked about and written in what we are very much aware of, Alma Ata Declaration of Primary Care, 1970s. Right. I hope you all now can recollect water cycle, and it is important here, especially these things. See, infiltration, when water so-called gets lost, even though a region may have a lot of rainwater, and when these things happen, how it affects health and how we as public health professionals are supposed to come into picture. So, we should know this. Safe water is this. It should be free from at least 3 types of hazards: physical, chemical and biological hazard. The first one is free from pathogens, means there is no biological hazard, and there is a standard, minimum standard. There is freedom from chemical hazard, there is physical fitness or physical hazards are not there. So, especially test and then ultimately usable for domestic purposes. Say for example, I hope some of you might have seen the ETP which is near your hostel. Any idea? No idea? तुम्हारे hostel के बगल में एक छोटी सी building है ना, it's called as ETP, Effluent Treatment Plant. बिल्कुल पता नहीं, थोड़ा आसपास देखना है ना. If some expert, some examiner comes through gate number 4, the first question they will ask in your viva would be, you saw a building there, ETP, what is ETP? So, Effluent Treatment Plant, it treats the wastewater coming from the hospital. And then there is a sewage treatment plant. If you have ever walked towards the residential area, there is a sewage treatment plant. Sewage and effluents are different, and they are important when we talk of water. They will be important when we are doing history taking and trying to understand what we call as contextual factors, or you call as determinants, what might have caused the disease. So, these things will be important. So, from effluent treatment plant we get water that is nearly safe, but not usable for domestic purposes. So, that will not be called as safe water. So, safe drinking water, another 2 important terms called as improved and unimproved sources. And you will be surprised and to know that the famous bottled water, Bisleri or whatever popular brands you know, they are unimproved sources. Why? Because of quantity. How many liters of bottled water can you provide? Thousands? Every day? Not possible, very costly, right? And if we are using something called as reverse osmosis process, ROs, it wastes a lot of water. So, that is not a feasible and permanent. That is why it is called as unimproved source of water. You would be asked in viva, you would be asked as a objective question, which of these is unimproved or improved source of water. Okay? Then the last one, problem villages, identified in 1960s itself. Any village which does not have drinking water within 1.6 kilometer is 1 mile. So, 1 mile is which you can usually walk within 15 minutes. So, that is a definition. So, within 15 minutes, if we do not have access to safe water or water, drinking water, at the time the term safe water did not come into picture, or in plains or at altitude 100 meters in hilly areas. So, that you again need to spend more than 15 minutes, then it is called as a problem village. And here, there apart from that, there may be waterborne diseases endemic, or water sources contain something which is physically hazardous. So, excess salinity, etc. So, people cannot drink it, that is why we call them as problem villages. Another popular question. Okay, can we try this? We have some idea about inorganic or physical hazards of water now. A bit tricky. तुमको नींद आ रही है, तुम बता दो, या नहीं पसंद आ रहा? You, no, तुम्हारे पीछे. Yep. You want to try this? Try and pay attention, please. चलो बैठो. That sleeping one, पीछे sleeping one. या last bench. हाँ जी तुम बीच में second one, last bench. बुक्स में नहीं दिया है जो मैं पढ़ा रहा हूँ, बुक्स में एक जगह नहीं दिया है. आर्सेनिक. रॉन्ग सर. सिट डाउन. थोड़ा सुन लो तो मे बी आंसर दे दोगे. वन मोर ट्राई. इट्स नॉट आर्सेनिक. आर्सेनिक इज नॉट impurity. Arsenic is pollutant. Impurity is not a pollutant. You can remove it physically also. चारकोल डस्ट नहीं आएगा है ना पानी में अपने आप. चारकोल इज समथिंग गुड, राइट? You can use charcoal to clean things. Water भी clean होता है. Remember those water filters? It has charcoal dust to clean. It's not an impurity. It can even clean. Adsorb word सुना है ना? Adsorb. Use charcoal to adsorb things. It's not an impurity. It will be a useful thing rather. It's mud, right? So these are the learning objectives. We'll try to cover this very quickly. So we know importance of water at cellular level as physiologically how we require water. It's predominant constituent of our protoplasm, main part of our body weight. It is required in various processes in the body. It maintains many things, many important and vital things, and necessary for metabolic processes, most of the metabolic processes. It's a very much important thing for us physiologically. And if we talk of water requirements, so we can talk of water requirements in terms of our physiological requirements. So 2 to 2.5 liters. If it's a temperate days like last 2 months, it would have been required for 2 liters. Otherwise, in summers, 2.5 liters for a usual person who is 60 kilograms of weight. At domestic level, there is a water requirement also. So for urban, per capita, 150 to 200 liters. Rural, the government of India aspires to provide at least 40. So when I say at least 40, the government aspires to do that. It will be very easy calculation. Get the population of a village and check for the sources of water, whether it is number of people into 40 per day or not. And we are talking of safe water and thinking of problem villages also. So we have this kind of parameters for water requirement, and it depends on this also. So if it's a very warm climate and or we are in terms of habits, if we are doing a lot of exercise, of course we will require a bit of extra water. Okay? I see doctors advising patients pani pijiye. People are at least as smart as you. I will not say more smart than you, as smart as you. They know that. So please do not spend your vital time in telling people khub pani pijiye. Tell them very specifically how much water you want them to drink. Before that, you ask how much of water are they really drinking. So if I tell you, get up early, will you like it? I tell you, get up early, jaldi utha karo. अच्छा लगा सुनने में? नहीं अच्छा लगा. क्यों नहीं अच्छा लगा? Because you are doing it. If you have to come to this class, you have to get up early. You are not getting up at 10 a.m. or 11 a.m., which some people may be doing, which we want to change. So that's why we first check. I will ask you, when do you get up early? Or for some of you who are not present. So similarly, when we are giving this kind of advice, we have to take that in mind. So if we have that as a requirement, what is the usage pattern of water? This is the usage pattern of water. How much of water is used for which? So you can see that most of the water is used for agriculture, and that's why when I'll talk about the prevention and control of water related disease or the water related programs, the programs by government talks a lot about, mostly about water availability for agriculture. Then we have for industries and households and recreation and a swimming pool kind of things. So it's mostly agriculture, industry and households. And if it is for industry, that will become a source of hazard. Okay. So how water is related to health? Why it is important? Because I talked about this positive health. So there will be no positive health and well-being without safe water. Clear? And as early as 1981, drinking water was considered as a basic element of primary care. So you remember primary care? That was considered. It was there. Safe drinking water as one of the key elements of primary care. And the third thing which you should understand very clearly when we talk of something called as ideas of illness. I guess you will not be taught about family medicine. So, if you get a chance to teach you family medicine, we will teach you 3-stage assessment, and in 3-stage assessment we have something called as ideas about illness, individual assessment. So, people including you might have this idea. There is no concept of pure uncontaminated water in nature, because that's what people will be telling you. अरे क्या करना है डॉक्टर साहब, पानी तो बढ़िया हो तो भगवान का है, सब बढ़िया होता है. No, 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 it's not uncontaminated. The pure water is not available. It never was available. Even if no industries are there, still the water would get contaminated with what? Wild animals excreta and its urine. Even vegetables means vegetation. Okay? So there is no concept like that. That's why we need to think of having this notion that safe water has to be made safe, whatever water is available. Okay. We should also remember concept of how much fluoride is important, or nitrates, how can influence water. These are some examples how TDS makes water more useful for us, because it can prevent cardiovascular. It has shown to be able to prevent cardiovascular diseases. And as compared to that, we have nitrates, which is known to rarely cause methemoglobinemia. So some of the examples are there. We know that as innocuous thing as water may be related to health in positive way or negative way. So what about India? Though we have 18% of world population, we have only 4% of water resources. So safe water provision and other things will become very challenging for us. And the majority of the global population has access to safe drinking water, but still, as late as 2025, nearly 26% don't have it. So if we talk in absolute terms, we have 37 crores of people use unimproved sources of water. Now we remember unimproved sources, and that may include those urban junkies who use only bottled water. So they will be considered as using unimproved sources. पानी लेके अपना गए नहीं, कहीं बाहर घूमने जाना पड़ा, बॉटल वाला पानी तो है नहीं, मालूम नहीं कौन सा पानी सेफ वाटर कहाँ से मिलता है. Then those people will be a very extreme example although, but there are a lot of people who do not have improved sources of water, and a lot of them use surface water, straight surface water. That is the most polluted, that can be the most polluted source of water. The second one, see, we often talk of hand hygiene. When you will be seeing patients, parents or patients themselves coming with acute gastroenteritis or many other diseases which are those water related diseases, and you will give the advice of hand hygiene karna aap अच्छे से. Then you should remember that nearly 30% of people globally, including India, do not have water for sanitation, and that will be true for Bhopal also. I guess some of you went to that colony, you were not there. Last year we had a health camp, hardly 8 kilometers from here, Katara Hills. Beyond there are colonies. People do not have water for washing, for taking a bath. As near as 10 kilometers from AIIMS Bhopal. So ऐसा नहीं है, वो urban myth नहीं है. People will not have enough water to drink. So when we give those kind of advice, it's very humiliating for them. When you tell them that please, आप हाथ नहीं धोते हो, they do not have the water. They have only enough water to drink, and that too unimproved or unsafe in urban areas also, especially urban slums. Okay, very important. The last one. That might include water coming from your homes, my home, in my village. That water has not been treated, it is simply being dumped. So if it is being dumped, the groundwater, the sources of water will get contaminated. So as nearly as half of the household waste water is discharged. 15% of total water used for households, half of that is supposedly infecting or contaminating other water. How much is the burden? So 9.1% of global disease burden and 6.3% of all deaths. So that's why I was talking in terms of Delhi. This is Delhi. And out of this, nearly 1/3 is still diarrhea, acute gastroenteritis. See? And how much of that is happening among children? So nearly 3 lakh deaths, or a bit less than 4 lakh deaths in under 5 children. Still as simple thing as water related disease, diarrhea. What if we do something about it? We'll save a lot of money. So if we do It's very cost effective. It's not costly to provide safe water. If we do that, we will save money from the money spent on treating those people. And we can use those for, if you are more interested in doing some advanced things, it will get you the linear accelerator and the CT scans. If you don't, your CT scan machine will not come because there is not enough fund. Got it? If you remember, when I was telling you the importance of environmental health, I was telling you why it is important from you, and one of the reasons was you can be a change agent. So, this is your arrow, your weapon to tell the policy makers whenever you get an opportunity, please do something about it, because my or our CT scan machine is not coming because your money is being spent on purchasing ORS. It's very costly to purchase ORS. Got it? Okay. So, some examples of how reduction in morbidity can be done by small measures like improved water or improved sanitation or simple hand washing, and of course, we need. What about India? So, about 15 is the tally, 15 per thousand is the death happening in India, and it comes in between the world's poorest performers and world's poorest performer and best performers. So, best is having only 2 per 10,000, poorest is having 107 per, 10% they are having, 10% of total Delhi because of diarrhea. There are certain countries and we are having nearly 1.5 the Delhi. So, and then this is also related to water, this malaria, but you would be surprised to know malaria is no longer a disease of public health concern in India, although government and everybody is still pushing for it, but there are other diseases which are more important in that same segment, in the same segment of vector-borne diseases. So, WASH is water, sanitation and hygiene. Water, sanitation and hygiene. Sanitation is not removal of excreta, it is something which has bigger spectrum. So, if we see how India performs with its neighbors, so you can have some idea. There are countries like Thailand, countries like Maldives. Of course, they are dependent on tourism only, so they have to keep this at a very high level. And we are nearly good in terms of providing safe water, but sanitation we need to do a lot of, and this is as late as 2021. So, whatever the claims are there by the governments and the agencies or the public health entrepreneurs, we have done few things. I will show you how did we reach till 90% or 71%. It did not happen in a day. Okay, so what are the sources? We can classify the sources in terms of 3. So, first we need to understand the characteristics, something called as safe yield. So, safe yield means how much quantity is available, and it should be able to provide water for 10 to 15 years. So, the planning has to happen for 10 to 15 years. If there is a new township coming or new urbanization is happening and water source has been identified, it should be there for 15 years, okay? 10 to 15 years, and it should be adequate at least 95% around the year. So, it should not happen that for 3 months or 4 months there is no water and people are moving beyond 10 kilometers, 20 kilometers. I hope some of you especially who are from Maharashtra, are aware of a very, I can say, humiliating practice of water brides. Anybody from Maharashtra who knows about water brides? No idea? It's a very humiliating thing. There are places in Maharashtra, I will not tell you the name of the region, where men marry at least twice. So, one is the main wife who stays with her and do all the household chores, and there is another wife which is a water bride. She will be spending 8 hours every day to fetch water. Abhi bhi ho raha hai. There are issues. Why it is happening? Because the water source, the safe field has not been taken care of. Someday we were having a talk about how Bhopal is a great place, and then people in Hosangabad, which now is called as Narmadapuram, the source of water for Bhopal, a considered source comes from there. So, I will show you and what has happened. Okay, so the quality should be acceptable, it should be safe, then it will be considered as a source of water, right. So, what are the sources? So, one is the surface water and another is groundwater. Rain sometimes is considered separately also. In some books it is considered separately. So, we have classification of 3 types of sources. So, rain, surface water and groundwater, or We can simply say surface, because you cannot hold a bucket and get the water and drink it. So that can be an argument. So rain, rivers and stream, these are surface water, these are the groundwater. So how good or bad they are, and what is the source for us? So these are the three principal sources for us. I hope all of you are aware of this place. क्या है? Upper Lake. What about this? Kolar Dam. And what about this? Narmada River. Hoshangabad, Narmadapuram. Ames ka water would be coming from? Yeah, it comes from here. You are here. What about people in these villages? They do not have enough water. So somebody is, can I use the term steal? Bhopalis are stealing water of people in Hoshangabad? Yes, we are. We are. They are staying in areas which are, many of the villages in these areas are problem villages. ऐसे ही. Okay, so one example of problem village. I guess you understand what is happening here. It's a water tanker, and if you remember, water tanker was an example of unimproved source. Okay, so people are using it, and this is an example of, we all know, wastage of water. Tap se nikal raha hai. Does it happen in Ames? Every day. Why don't you do something about it? तुम्हारे हॉस्टल में देखा मैंने, पानी बहता रहता है, वो हॉर्टिकल्चर वाला. Please do something about it. Okay, next quiz, if you have got bored. So factors that govern and reduce exposure of water related diseases are studied under. I talked about these things in the first class: preventive medicine, environmental toxicology, environmental engineering, environmental epidemiology. Just one try, we don't have much time. One try. Chalo, ask him. He seems to be uninterested. Last 1 second. हाँ जी, फोन बंद कर दो. बताओ. हाँ जी, A. बिल्कुल नहीं. That's it. So the correct answer is the third one, environmental engineering. There is a public health engineering department in most of the ministries, especially the water ministry. AIIMS Bhopal also has a public health engineering department. So merits and demerits, merits of those sources: surface water is prone to contamination, groundwater is less prone to contamination. Surface water, it can get lost through various phases of the water cycle, if you remember. Barish hui, it goes everywhere. You cannot collect it. It doesn't get collected as much in the reservoirs or the rivers, it flows out. As compared to groundwater, it will remain. A lot of them will remain, and it is softer in nature. The physical characteristics is a bit better than groundwater, sometimes quite better than groundwater. There are places where the TDS of water is 10 times of the what is permissible, absolutely unusable water, and it is very easily accessible also. Groundwater, of course, it has limited supply. It's very slow renewability. If we keep on using it, there will not be any groundwater. And there are places where groundwater has got lost. And of course, we talked about it, and it requires arrangement for drawing out. So you need electricity. Okay. So how it gets contaminated? See, so there would be impurities. First example, impurities. It can be dissolved or suspended, and the dissolved ones are solids, the suspended ones are especially organic, inorganic also. And we have examples of organic, vegetable origin, animal origin, and especially these things. So this is what constitute the TDS. These are not the contaminants or pollutants, these are impurities. They can be removed physically also. That's why we have impurities. But of course, they are partial contaminants. And the main sources of water pollution or the contamination are these. So first one and most foremost is, of course, sewage. We remember the uses of water was in agriculture, in industries and households. We talked about how much of household water is being treated or not treated. So we have this example here, the sewage water, which is the kitchen liquid, the thing coming from human body getting discharged from homes, they can infect the groundwater. The industrial and toxic trade, so we have toxic metals, cadmium, mercury, those are pollutants. So if the industrial waste is being simply dumped either in surface water or groundwater, it will contaminate. The agricultural pollutants. So whenever we are talking of this pollution and when we talk of prevention, they can be linked. So whether something is being done for this, whether something is being done for industrial or trade waste, where something is being done for agricultural pollutants or something is being done for, this is very important, the last one, because this will be asked you in CPSCR. You will be asked about intermittent versus continuous supply of water. So if you, I hope everybody has presented at least one CPSCR, right? Okay. So, and if it was not asked, you should be prepared to ask it. Intermittent water supply, majority of the homes in urban slums will get intermittent water supply. What might happen? And you also should remember that water pipes are usually near to sewage pipes. And what might happen? If the corrosion happens in the improved water supplies, if the corrosion happens, there would be leakage. And if that leakage gets in contact with the sewage pipes, there would be huge pollution problem. There may be an outbreak of waterborne disease in that locality. It may happen in your hostel also. Okay? So you should remember this, how water can get and how you can classify them. So which are the diseases and hazards related to contaminated and polluted water? So the most important, of course, from the standpoint of medical people would be biological hazards. From the standpoint of public health engineering, it may be chemical or physical hazards, because the public would be happy if the water is not badly smelling. They would be happy with that. But for us doctors, because something which is not visible to the naked eye is more important. For people, things which are more important, things which is or characteristics which is visible to naked eye, color of water, taste of water, smell of water. So biological, and we have five ways we can classify, we can name the water related diseases, right? I'll give some examples of these. So water can become a cause of disease if we have deficiency or excess. So how we can have deficiency? If we have deficiency for a prolonged period, people may suffer from something called as symptom diya hai. So the name of the disease would be functional constipation. There is a disease called as functional constipation. This is one of the functional gastrointestinal disorders. Constipation may happen once or twice, but if it is happening frequently, there is a definition of it. Okay? So functional constipation, of course, people very frequently will suffer from UTI if they don't drink enough water. They suffer from dehydration, SOX, acidosis. If you drink more, beyond the required quantity, some people will have it because of myths and misconceptions, or there will be some psychological problem. So people may suffer from bloating, especially if they have IBS, or acute gastric dilatation, hyponatremia, pedal edema. If they are suffering from diseases and erroneously they are taking more than the usual amount of water which is required for them, they will have it. So water as deficiency or excess can cause diseases. Water may be a vehicle for diseases. So examples are most of these microbial diseases. Water can be a breeding ground for vectors. These examples, malaria and dengue, these kind of examples, and water can get polluted. So if it happens, then these kind of examples. We remember the window of fluoride or fluorosis is very narrow. So we had that example. And then arsenicosis is a very popular, very interesting example. So arsenic is found naturally in where? Earth's crust, but it is not present in top layer or the surface of Earth. It is present a bit below. So 200 meters, 300 meters, arsenic would be there, present as one of the minerals as part of a complex compound. So if we draw a lot of groundwater and the water table keeps on going down and down and down, at the point arsenic will become available. And there are some chemical processes by which arsenic can get released, becomes free arsenic, and then it gets part into the drinking water. So arsenic mostly wahin se aata hai. There is the example of the entire Ganga belt is prone, or it has been shown to be suffering from arsenicosis. It causes skin cancer and various other conditions. Minamata is another example which happened in Japan. Similar diseases are known to be caused in India. Industrial effluent gets into seawater, pollutes the seawater and infects the fish. People eat those fish, gets this disease. So, these are the water related diseases. Example of waterborne diseases, the pathogen in the water that is ingested. Water wash disease, the water related the disease gets transmitted from one person to next, because the water the disease has not been washed. So, if we wash, then we will not have this disease. So, there are certain examples of this. Then we have water based diseases, diseases which are transmitted via an aquatic intermediate host. So, this is a third type of example, and water related vector borne, we are aware of it. And the last one is water dispersed disease. So, if the water gets converted into vapor and we inhale those vapor, then we become infected. So, 5 types. So, these are examples. Waterborne diseases we know, the classical ones are the typhoid, acute gastroenteritis. Non-classical is infectious hepatitis, of course. A very commonest rather reason for infectious hepatitis is contaminated water. The water wash disease, trachoma, scabies, thankfully now we are trachoma controlled, eliminated or eradicated. We have eliminated trachoma. Eradication will happen once it happens throughout the world. Okay. So, we have India has eliminated. So, it is not present in India. Shigella, then water based disease, we have this kind of example like schistosomiasis, the intermediate host wala thing, you know this, and water related vector borne disease, very popular, we know about that. Water is dispersed, the most famous example is Legionella or Legionellosis or Legionnaire's disease. Some water borne disease example we can be classified further in terms of viral, bacterial, protozoal, helminthic and leptospiral. The second part of water related hazards is chemical hazards. So, we have examples of fluoride, iodine, nitrate, sulfates, lead, mica and water hardness itself causing diseases, right. So, although I talked that water TDS, high TDS is cardioprotective, but it is corrosive also. So, it may cause some corrosion on skin if it is very high, and we have other examples. Okay. Ever heard of this 5F in transmission of waterborne disease? तुम्हारा हो गया है infectious disease epidemiology? Not yet started? You might have read in probably class 11th, if I remember. NCERT की बुक में दिया हुआ है, मैंने देखा है. बताओ. उसको अभी भी मज़ा नहीं आ रहा. सेकेंड पर्सन क्या हो गया भाई, तुमको बिल्कुल मज़ा नहीं आ रहा था. सेकेंड वन, यप, लास्ट वेज. No idea? You do not want to try also? Try तो करो. हाँ जी. Fields, okay. Face, okay. One more try, if you want to do. One more try. Anyone? We do not have much time. No more try, but ठीक है. I might confuse you, even if the answer was correct. I will do it. Okay, so how water related disease happen? What are the pathways? How this exposure happens? Let's examine that. I hope you have heard about chain of infection. If you have not, please have a look. If I am asked to teach you infectious disease epidemiology, this will come repeatedly for each infectious disease. So, in chain of infection, we have something called as the infectious agent, and it traverses through, it remains in a reservoir, gets out from there through a portal of exit, then comes to the source of infection. From the source of infection, it gets transmitted by various modes of transmission, direct, indirect kind of. Then this happens through a portal of entry inside the susceptible host, not all hosts. So, not all human beings are susceptible to all kinds of agents. And we can decrease the susceptibility, especially by processes such as vaccination. Many water related diseases will get a place here, and when we talk of that 5F thing, it is ingrained in this chain of transmission. And we teach you disease control programs. We sometimes may teach you, when I will teach you how this particular disease control program is being planned and which part of this chain of infection is trying to get broken. So, this will be one pathway. If the infectious agent gets into the reservoir, sometimes the reservoir and source is same, sometimes, not always, right. The drinking water, the water you drank is the source, but it came from a larger body, larger source of water. That was the reservoir, but you were not drinking from a river. You drank from some water, some bottle or some other, maybe your pipeline. From there it exited through water pipelines. So, when we talk of this, we talk of. And how does it get transmission? The famous 5F. So, feces or other liquid waste, fingers, flies, filth and fluids. So, from feces it may get entry into fluids and ultimately goes to food. So, even the fluid may be directly consumed or it becomes a part of food and then gets into the host. How do we break it? How can we break it? So, we break it here. We do not let feces enter any of these. How do we do that? By sanitation barrier. Or even if it has entered, we can try to do something about this. For some reason, the feces got stuck to fingers. It will in some people. So, before this fingers gets into food and fingers gets into the host body, we do something. What do we call that? Hand hygiene. ऐसे एग्जाम में पूछा जाएगा, ऐसे एक्सप्लेन करना है. They will expect you to draw this picture and explain each part, and then try to explain the names of those specific strategies which we use, and ultimately the names of the programs. Okay. So, how prevention and control has happened in India? How to prevent? So, we remember this. I talked about this. So, how do we prevent? By improving sanitation, access to safe drinking water, hand washing with soap, general personal and food hygiene, exclusive breastfeeding improves the immunity and the susceptibility goes down, and sometimes vaccination, especially the rotavirus vaccination. So, this is for diarrheal illness, one example. Similar example can we have for other waterborne disease and other diseases that will be taken in detail in your infectious disease epidemiology module. So, some examples of options for control. One example I have taken again for diarrheal disease. So, acute gastroenteritis, we have specific treatment, we have chemo prevention, we have a vaccine. So, some of them may or may not have vaccine, like helminthiasis, protozoal waterborne disease. Anti-helminthic agent are specific treatment, but there is no chemo prevention and there is no vaccine. For many other, there would be vaccine. Infectious hepatitis, there is no specific treatment, there is no chemo prevention, but there is a vaccine. And we need to understand how much seroprotection that vaccine is. And when we go into public health, we have these as examples of control measures. Which of these can be done at a larger level? Do we need to spend, if we have 200 crores, can we spend all of that on antibiotic only, or the vaccine, or this vaccine, or purchasing doxycycline, which? That kind of decisions we have to take. So, we need to remember, right? And how do we prevent transmission? This can be another example. So, your MCQs will have which of these is most effective, specific chemo, vaccine or transmission prevention, and there would be evidences for each. If you remember the number of deaths and disabilities and dialysis which were being caused, how much will be decreased by this at a larger level, or this vaccination at a larger level, or simply improve water. We saw some examples, right? Improve water kar dein to 29% decrease, somewhere it was 20% decrease. This will be asked. Okay. Okay, so what are the indicators? If we do that, how do we know it is being done effectively? So, some examples can be simply the coverage of improved water. If we claim that improved water is being provided to the people, what is the coverage? So, we got that example, 90% versus 77% for high sanitation. That is the national level values. What about in Madhya Pradesh, in Bhopal, in AIIMS Bhopal, in Pipalia, wherever we are supposed to do the intervention at a community or larger level? Other indicators will be a very distant indicator called as mortality indicators or morbidity indicators. We are talking in terms of improving the exposure pathway, controlling the exposure pathway, so vaccination or deworming, anti-helminthiasis, right? What has happened in India? So, we have something called as surveillance. I hope you understand what is surveillance. If not, we will have in some of the classes. So we do surveillance of diarrhea, dysentery, cholera through IDSP, Integrated Disease Surveillance Project, now it is called as program. We do surveillance. We keep a record every week, every month, and then try to see whether it is decreasing or increasing. The diarrheal disease control happens through IMNCI, Integrated Management of Newborn and Childhood Illnesses. There is a clear protocol which probably will be taught in pediatrics also. This is what the basic level staff, basic means the most peripheral level staff, health staff does, or even non-health staff also does it under NHM. Under it, we have concept of low osmolality ORS and provision of zinc for 14 days. That's how we control in India. Examples. What has happened till now? So since independence, a lot has happened. As early as 1954, we had National Water Supply and Sanitation Program, one of the earliest in the world. And it went through so many things. So we had National Rural Water Drinking Program. This was only supply. It was drinking water, 69. Then we have isolated water supply. Then there was a Water Act. So I told you in the first class on environmental health that as a doctor, if you have to start a hospital or if you are given in charge to take care of hospital administration, you need to know all the provisions of Water Act, especially those which apply to running the hospital and before that starting the hospital. So there are certain permissions, there are certain fees, there are certain certifications which are required in Water Act. Next class, I'll tell you some of those provisions. And then the entire thing was made a part of minimum needs program of 1975. It had 20 components. Then there was a decade of drinking water, 1981 to 1990. Then National Drinking Water Mission happened in 86. So it went through many things. The first water policy, I hope you understand what is a policy is, a government's commitment. So there a policy came. You remember that? Problem village, safe water, everybody will be given or not. So every policy talks of something. Say for example, one of the earliest policy talked of 80% of urban water supply would be safe. 20% of rural water supply would be safe because that much money was available at that time. And even the technology was not that advanced. Abhi to big moving vehicles are present, right? Bade pipes so haath se to nahi khote na, to you do it by machines. In 70s, 80s, there were no machines globally. Kahin nahi tha. So it kept on happening. The total sanitation campaign was a very, very popular thing when I was doing my MBBS. We used to have questions on that. That has been renamed into Swajal Dhara program. Then National Water Policy happened. Madhya Pradesh also had its own water policy for the first time in 2003. Bharat Nirman was simply renaming of Total Sanitation Campaign, 2005. I started PG. And it was made a part of Jawaharlal Nehru Urban Renewal Mission, then National Action Plan for Climate Change. It was one of the components of this action plan, the water. Then we had Rural Water Drinking Mission. That Bharat Nirman program got renamed as Nirmal Bharat Abhiyan in 2012, which was renamed as Swachh Bharat Abhiyan was our current Prime Minister. So things have been happening. बहुत दिनों से चीजें चल रही हैं. Slowly, right now we have many missions. So Jal Jeevan Mission or Sahi Fasal Campaign or Atal Bhujal Yojana. These two are related to agriculture water. Jal Jeevan Mission is for provision of safe water. Then Jal Shakti Abhiyan is for getting rainwater. So some 500 reservoirs have been identified under Mission Amrit Sarovar. किसी पे भी छोटा सा क्वेश्चन आएगा और कोई पूछ देंगे तुमसे, स्पेशली पीजीज भाई पढ़ लेना, राइट? Okay, so I hope I did a lot of research to get this. Not present, all of these is not present in the book. So I hope it is useful for you.